The community deal is very much a key ambition within the Frimley Integrated Care System strategy. It's very much an enabler. The individual people in individual communities have a much better understanding of what works for them and their communities than probably we do as organisations.
This ongoing dialogue between ourselves and those we serve, and you have to give help and support to people in a way that they feel they can access, that they can use. We don't have all the answers, and very often our communities do.
We're standing on the site of what will be our new community garden in Fleet. I think people have had a lot of restrictions placed on them in the last 18 months, lost control over their lives a bit, and I think this is going to really build people's resilience back up and keep them fit and healthy and happy and make new friends.
We're really bringing together a whole variety of people from across our district where they can share their experiences, they can socialise, they really get an opportunity to get out, and that's so important for community spirit, health and well-being, socialising. It's really important to us that we create a place that people value and love and want to come out and use.
In my role, our main aim is to build partnerships to ensure that places like the Heart Green Garden can be established. It requires a lot of partnership working, collaborative working, and I'm delighted to see that collaborative working has brought together everybody, and in the next couple of months we'll be able to start bringing it to life.
Working alongside Men's Shed particularly, they have been so supportive. They've built us some really great things for the site, saved us lots of money.
It was just natural, just felt right that when they told us about the community garden, was there anything we could do to help, that we said yes, of course.
At the end of the day, the community is key to everything, and for the NHS to recognise that is a real bonus.
Support from the NHS in helping to establish community gardens, men's sheds, and enabling us to run and provide that support is just so important.
When the pandemic started, a lot of the services, they moved online, or a lot of the support groups that was run locally, they moved online. And so our elderly Nepali people, they were struggling to, let's say, book appointment with the GPs or accessing any of the support system that is available.
So it's sort of like reducing the social isolation, but also it's like digitally making them competent, giving that sort of skills.
Many of these people live in a HMO as well, housing in multiple occupations, and pre-pandemic they used to come out in the park like this and mingle with other people. When they were by themselves in those rooms, they had no phone, they had no television. That obviously really impacted their mental well-being as well.
We have been delivering online sessions via Zoom. We do sessions once in a week.
There is a gap between the community and the service provider, and I think projects like us, projects that are led by people who are in the community, helps to bridge that gap. Because you guys have given us this funding, you guys have really encouraged us to do more in the community, and we are able to connect with lots of young people and other organizations, and that has given us lots of confidence.
We have seen what is the demand and what needs to be done, so when you listen to us, then we get more done, we get to help more people. I think that's the one message.
Seeing the work that both individual residents and communities are doing is really absolutely awe-inspiring, and it's what keeps me going.
The one message I would give to communities is you can and you are able, and we are listening, and we can support you, sometimes with funding, to achieve your visions and your ambition. So come on board, work with us, the door is open, and we want to hear what you have to say.